everyone. My name is Resha. I am a patient care coordinator here at Protea Medical Center in Tempe, Arizona. I'm just going to talk a little bit about what it means to be a patient care coordinator, especially at a naturopathic clinic. Me personally, I enjoy it because the way that the doctors meet with the patients, that's kind of their main source. That's their go-to for everything. And then they get that patient care coordinator and they're able to build a rapport and a friendship with their said patient. One of the things I love most about it is that even though there's hundreds of patients and I might have my patients with Dr. Warren, I'm also able to assist any of the other providers in helping them out with some patients that their patient care coordinator may not be in office for, or if it's a confusing situation, or if I'm the one that takes the phone call and I want to follow it through, I can. So one of the things that a patient care coordinator does is medical records, is going to be doing checkouts for the patients, making the labels for the medications, charting everything, ensuring that the medication list is accurate. Another thing that we do is referrals and following through on all of our faxes, uploading, if someone goes out of house for a lab draw, instead of coming to Protea, we find that in the fax and we can upload it, send it off to the doctor and ask them, hey, they have an appointment on this day or they don't have an appointment. How would you like us to follow up? Do you want to do a brief phone appointment, a brief in-person, quick 15-minute end-of-day phone call, or a full lab review? One of my favorite things about being a patient care coordinator is the fact when a patient goes, hey, I need a referral, let's say to a nephrologist or an endocrinologist, and I get to kind of be a little FBI investigator in a sense, going through their whole chart, finding out, okay, what symptoms have they had? What have they tried? That didn't work. Let's put that in the referral. That way, then the specialist can read through that letter of recommendation and get more of a patient history. That way, then they can go into that appointment being like, hey, I see that, you've had this in the past and you've tried this and it didn't work. And then you tried this supplement and that was good. And now you're still having these issues and these symptoms. Let's figure out how we can help. Best part about that also is once we send off that referral and the patient schedules, 9 times out of 10, we don't even have to follow up with the specialist. They'll be able to send us those records right back then and there. We can go ahead and upload it, give it off to the doctor, meet with the provider saying, hey, I don't know if you want to do a quick follow-up, or how about you just meet with me and you can figure out what you want to discuss. And then I'll just call the patient during my little 15-minute patient care coordinator phone call slot, and I can follow up with them on anything. One of my favorite things about working here is the camaraderie between everyone. It doesn't matter what your background is, what your previous job history is. Everyone has the same agenda, and that's to be the best for that patient and to be kind of a light of fresh air. It doesn't matter if you're the front desk receptionist, if you work in the medication department, or if you are a patient care coordinator, or even just a regular medical assistant. Everyone helps everyone, and it doesn't matter if it's a super big situation or something as simple as, hey, can you help me with this refill request? How do I word this sentence to this patient to respond to them? Everyone helps everyone. No one gets mad at each other. Everyone is friends with one another, and there's just a lot of laughter here. A patient story that means a lot to me happened not too long ago. I gave her a call. I let her know what we were planning on doing. And during that phone call, I just let her, talk to me about whatever is going on. It wasn't, where I just called her and said, hey, just want to let you know we're sending this medication. Let us know when you receive it. I just let her speak to me, and I didn't even interrupt her once. I just said, what's going on? How do you want us to help? Let's figure this out. She spoke. We got it. Everything was good. The following week, I was actually out of the office and I knew I wanted to follow up with this patient, and I wanted just to check in after a couple days to make sure that everything was good. You know, these last few days were a little bit better than she had envisioned. And so I asked one of our other patient care coordinators to reach out to her and just say, hey, Resha's out of the office, but she wanted to follow up and see how these last few days have been. How are you doing? Is there anything I can help you with? Can I talk to Dr. Warren about something for you? Even though I was out of the office, I still wanted to follow up with her. I still wanted to know how she was doing, and that she appreciated that I had someone else follow up that she has talked to in the past as well. Thank you so much for listening, and we hope to see you soon.